A deadly drug is racking up a new toll in our province, and health professionals say it is unlike anything they've seen before. Carfentanil, which is said to be 10,000 times stronger than morphine, has prompted a serious warning from Ontario's chief coroner as the number of deaths is rising at a disturbing rate.
This is a dramatic increase within a period of 4 months, and so it's quite concerning.
Here are the startling numbers. In the first 4 months of this year, carfentanil has been linked to at least 142 deaths in Ontario. With 50% of cases still under investigation, the number could double to 280. Compare that to the total number of carfentanil-related deaths in all of 2018, 95.
Those 142 people were people. They lived with loved ones. They were living their lives. These were not people who chose to take their lives in any way whatsoever. These are people who were using drugs and suffered the consequences of a very toxic substance.
Carfentanil has traditionally been used by vets to tranquilize large animals. The drug itself is also virtually undetectable when added to common street drugs like cocaine, heroin, and other opioids, leaving many users vulnerable.
They don't know that the carfentanil is included in drugs that they've obtained.
Outreach workers say substances aren't what they used to be, significantly more dangerous than even 5 years ago. Is it scary hearing that there's something like carfentanil out there that's becoming more prevalent, something so dangerous like that?
Well, yeah, definitely, for sure. Mostly for people who don't do that, right? If you're looking for like coke or heroin or, whatever it is that you desire, if you don't know that it's laced with it.
Some studies suggesting carfentanil is 100 times stronger than fentanyl. The crisis comes as the provincial government cut funding to 6 supervised injection sites. Advocates say it's a huge mistake.
We've saved many people's lives. It could be scary, but you have to be able to respond quick, right?
Yeah.
If you freeze up, you may not be able to save somebody.
And another sharp spike, the number of urine samples that have tested positive for carfentanil has gone from a range of 0 to 100 per month in 2018 to more than 700 in April and May of 2019, indicating just how prevalent it is becoming on our streets.
In the city of Toronto, we have seen the overdose crisis continue to accelerate, except in Toronto, unlike every other city in Canada, the number of people who died due to overdoses last year actually went down. And so while in Canada we're losing 11 people every single day to overdoses, in Toronto, due to our proactive work around our overdose action plan and the opening of these sites, we've seen the number of fatalities, while still too high, going down.
Minister of Health Christine Elliott wasn't available for an interview today, but her office sent us a statement saying the government has committed $3.8 billion over 10 years to develop and implement a comprehensive mental health and addiction strategy. They say they also approved 15 consumption and treatment services sites in communities with the highest needs across the province.